Welcome to our presentation, Building a World-Class Specialty Contact Lens Practice. My name is Lynette Johns, and I'm the Director of Clinical and Scientific Affairs at Visionary Optics. I am going to be the moderator for tonight's presentation. It is my pleasure to introduce our panelists tonight. We have Dr. Kate McClure, who practices and is part owner at a multi-location private practice, Professional Vision Care in Columbus, Ohio. She not only received her optometry degree at The Ohio State University, she also completed a 2-year fellowship in cornea and contact lenses, while also earning her Master's of Science. She loves fitting specialty contact lenses, and she is an assistant clinical professor at the Ohio State College of Optometry, while also working in private practice. Next up, we have Dr. Jackson Lau. He practices in a very busy MD-OD practice, Silicon Valley Eye Physicians in California, where he also fits specialty contact lenses. He received his optometry degree from the UC Berkeley. He also completed a residency in cornea and contact lenses from the Illinois College of Optometry. He, too, is adjunct faculty at both ICO and NECO. In addition to that, he's the Senior Manager of Professional Relations at Euclid Vision Corporation. Last, but certainly not least, we have Christie Yee. Christie was a specialty contact lens fitter at Park Nicollet in Minnesota. The NCLE designated her as a master contact lens practitioner, and she has over 20 years experience fitting both sclerals and orthokeratology. She serves as the practice management and implementation specialist at Euclid Vision Corporation. We also want to note that the opinions expressed in this presentation and on the following slides are solely those of the presenter and not necessarily those of Euclid Vision Corporation or its affiliates. Euclid Vision Corporation does not guarantee the accuracy or reliability of the information provided herein. Now, our goal tonight is to have an informal discussion to learn how to create a strong relationship with staff in building a center of excellence in specialty contact lenses. So with that, I know I gave everybody's bio, but I just want to welcome you to tonight's presentation. It's so great to have you all with us.
Thanks for having us.
Agreed.
So I'm going to kick this off because what we want to talk about first is myopia management and scleral lenses. So my question to start is really for all three of you. And really, how did you get started doing both orthokeratology and scleral lenses in your practice? I'm going to start with you, Kate.
Sure. So during my fellowship at Ohio State, I had the opportunity to fit both products, and it was really important to me when I was looking for career to find a practice that would allow me to do that. So my busy private practice was a perfect opportunity for me. There was a lot of families, a lot of children, so opportunity for myopia management, Ortho-K. But being a busy private practice in Ohio, there was also opportunities for keratoconus, post-LASIK, and scleral lens fits. So that opportunity really allowed me to fit all the lenses that I love.
Great. Jackson, what about you?
Yeah, I think I had a very similar story and background to Kate. As a disclaimer, everything that I'm going to say today, nothing really came from me. It was all stolen from great mentors and people that I've worked with. And ultimately, residency is where I had great, amazing faculty at the school, but I also had the opportunity to work with Dr. Casey Hogan. She had an amazing private practice where she dedicated it to specialty contact lenses and dry eyes. And I was just amazed at everything that she was able to do back when there weren't that many, dry eye centers of excellence or, contact lens centers of excellence. She was one of the first people to do it. And it just gave me motivation to, find similar practices. And after residency, I was able to luckily work with a practice that had nice, amazing corneal specialists, and we had a strong focus on myopia management. And that's pretty rare to have that kind of combination sometimes, especially with corneal specialists who are willing to, allow you to do, especially with Ortho-K. And with that freedom, I've been able to grow a lot and fit a lot of patients and hopefully share some of that experience today.
Great. Now, Christie, you have a different background than all of us. So tell us, how did you get started doing both when you were fitting contact lenses?
How did I get started? So I've always had an interest in specialty contact lenses. And so I became really involved in the Minnesota Contact Lens Society. And kind of like Jackson, I've had some of the most amazing mentors in my life. I'm fortunate to have Minnesota cornea and contact lens in my backyard. So, Jason Jedlicka was still heading the helm there, and he was like really heavily involved in it. We've had a lot of greats that are from this area. Even our Euclid's Craig Norman is from this area. Buddy Russell, Pat Caroline, all of them just really enjoy coming here and lecturing. And Brooke Mezer brought Stephanie Wu, and I mean I've just had like the most amazing mentors my entire career. So it just seemed natural to keep following this specialty lens path.
That's great to hear. In my past, I was also residency trained, and I did a lot of both Ortho-K and a little bit of sclerals because they were just starting for the most part. I was at the Boston Foundation for Sight at the time, so that's where I saw most of my sclerals. So orthokeratology was my passion, and I found it was very easy to transition to designing scleral lenses, mainly because you have the same anatomy. And so I was in my head, I was able to conceptualize the design and how it landed, and the reverse curve is like the intermediate curve on a scleral. And also, just the optic zone is the optic zone universally. Did you find anything like that was helpful? Like one modality helped you fit the other, or I don't know, or was it just me?
I think personally for me, like when you can visualize and conceptualize a scleral lens and how those adjustments are going to affect the on eye, when you can actually see that in your head and what that looks like, it makes all other contact lens fitting, I think, easier. I don't know. I think the strong understanding of the scleral is just like everything kind of came into focus once you learn that.
Yeah, I would echo that sentiment, Lynette and Christie. I think, especially now that we get the opportunity to, teach students still, a lot of times sagittal depth, sagittal height of the lenses, it's such a simple concept, but also sometimes a little unnerving if they're not familiar with it. But if you understand sagittal heights and sagittal depths, it's the same thing whether we're doing it on the cornea or whether we're vaulting the cornea. So I think the concepts are there, and as long as you can translate those concepts, there's not a lot of memorization is when I try to teach them. It's just, you learn the basics and you can apply those foundational principles to both designs.
Exactly. Kate, I got a question for you. When you're running your practice and you're so busy trying to see all the patients and do everything, you're seeing primary care as well, correct? Or are you exclusively specialty?
Oh, primary care as well. Mm-hmm.
So you're wearing lots of hats in the clinic. So what have you done with your, how do you have staff? How do you delegate to staff to make your life easier? Like, what do you do if it comes to like workups or imaging or application and removal training, paperwork? Like, how do you manage all of that in your clinic?
Sure. So it's definitely a lot to manage. When I came into my practice, the technicians were really well versed in pre-testing patients and doing imaging, but specialty lenses, they didn't really have a lot of background information or knowledge. So early on, when I was fitting patients in scleral lenses and Ortho-K, I found that I was using a lot of my chair time and that I had to catch some of my staff up to speed pretty quickly in order to run a more efficient clinic. So if you invest time in staff early on, teaching them lens insertion, insertion and removal for patients and that training, if you invest that time early on, it will save you hours of time in the future. So I think it's important early on to really find those staff members that are excited and willing to learn. And, if they're in the room and see the impact that these lenses have on the patients, they'll be excited about it. It's really not hard to get staff enthused about Ortho-K and scleral lenses because they have that wow factor for the patients. So my advice is early on, invest in your staff, and that will give you a lot in return.
Actually, a good question for Christie, because you've worn many hats as well. And so when you first came on board, were you considered a specialty fitter, or were you actually designated in a different role? How did that happen for you?
Yeah, so my background is actually retail. I managed a Sam's Club optical for like 15 years prior to starting with Park Nicollet. When I came on board at Park Nicollet, I was considered a contact lens specialist. My doctor that I worked with at Sam's Club was absolutely amazing. He was like, like, if you want to learn something, I want to teach you. And so just to echo Dr. McClure's advice, like, invest and train your staff, because you've given them not just a job, but a career, and they're going to be way more invested in your practice. So I was pretty well versed in contact lenses prior to switching over to Park. And then I did quite a bit of mentorship with, she was a fellow of the Contact Lens Society before they turned me loose doing sclerals. But all the other like soft contact lenses I already had under my belt.
And Jackson, you have a different practice when it comes to staff, because you also have students rotating through your practice as well. So how does that work in what you're doing?
Yeah. So in our practice, usually we might have 3 doctor schedules running at the same time. And so I have a combination of 4th-year externs who rotate through our clinic. We have technicians, and then we also have NCLE contact lens certified staff who are sometimes, either helping us independently with their own schedule, or in conjunction with us during the schedule, during the busy day. So ultimately, there's a lot of juggling around. It's not unlike what we, if you've ever done anything in school with working with multiple students at the same time, just juggling multiple cases in your head. But once you get used to it, it actually works pretty well. And what I really like about it is that, especially for myopia, where we may have a really, let's say, aggressively progressing myope who I might want to see them 4 times a year, like a severe glaucoma patient, right? My staff, the NCLE staff, they can actually see them on alternating visits. And therefore, I'm not necessarily taking up all the chair time in my practice, but at the same time, I'm sort of giving them the value where they're being seen in the office, every 4 months, so we can track their axial length, their myopia progression very carefully. So I think that works for us. It's sort of like the dental model where you have the dentist, you have the dental hygienist, and when you go in for the cleaning, you don't always need to see the dentist, right? So same thing, as long as the staff are really well educated, they take pride in what they do, they're taking axial length, they're taking vision measurements, and if there's anything concerning, they'll obviously call me in. But if everything's going according to plan, then my staff will just say, hey, everything's going well. Dr. Lau will just call you later with the results if there's anything unusual, but everything looks like it's going according to plan. So he'll see you in about 3 to 4 months. So I think that works really well for sort of our practice.
I know you're on faculty. Do you have students rotate in your clinic, or are you at the optometry school teaching, or both?
So a little bit of both. I teach at the optometry school, and there the students are doing most of the direct care, and then I'm supervising a group of students also providing care. And then at my practice, we do have a student that rotates through our office. That student is actually not with me, with another doctor in our practice. But having the students is fun, and it's great for them to see, a successful practice so that they can hopefully take some nuggets away with them.
Absolutely. I think the students are lucky to have you both. Christie, did you have any optometry students rotate through your sites as well, or?
Yep, it was actually not uncommon to have various students or interns coming through. They do a contact lens rotation.
Awesome. I just got a question coming through right now, and it's related to students. And basically, I'll throw this one to you, Jackson. It's, how do I become a site for students to rotate in my clinic?
Yeah, sure. So historically, our practice has worked with multiple colleges and schools, and so it wasn't that difficult for us to just restart that process. But nowadays, I think, first of all, I think it's important to really have the foundation and understanding the basic principles and everything that you're doing, especially if you're building a specialty contact lens practice. But once you have that foundation, I think the students really, there's not a lot of opportunity for them to get specialty contact lenses, especially as third and fourth years. A lot of times those patients get reserved for like the residents, let's say. So it's a really good opportunity for, students who want to have that opportunity, and they're looking for, places that offer Ortho-K. It's just not that common within even like the schools or even all the different sites. So if this is something you're passionate about for myopia management, it's always a great idea to reach out to the schools. But also I think GPLI.org, now they have a link through their website where you can specifically link up to students if you're interested as a practice. So I think it's a great way to keep yourself motivated. It keeps you on the top of your game as far as education wise, so that you're constantly updating on the latest products, the latest techniques. And then the students really appreciate it. They'll keep you motivated and interested in practicing.
Yes, the GPLI is a great resource for specialty contact lens fitters. And basically, they're supported by the Contact Lens Manufacturers Association, the CLMA, and Euclid and Visionary Optics are also proud members of the CLMA that supports the GPLI's efforts. I think the website, though, is gpli.info.
That's right.
Yes. So,
I actually used
go
that website a lot when I was first getting started in my practice. It was really helpful. They've got so many tools, lots of webinars. So that was a great resource for me personally when I was new into practice right out of my fellowship.
Excellent. Yes, it's a paid membership, but it's just a small amount, and you have so many resources and access to lots of materials and information billing coding. So it's something that I would encourage anybody attending this webinar to look into as well. When it comes to your staff members, Kate, how do you have like a separate schedule for the technicians, or how does that work in your practice? Are they just available, or do they have their own clinical schedule?
Yeah, that's a great question. I think ours is set up a little bit different than Jackson's. So the technicians are working with me with my schedule. They do not have their own schedule. The only, I guess, separate schedule they have is for our contact lens classes that we call them, and that's the insertion and removal training. So they do have a separate schedule for that. But otherwise, the way our practice runs, we've always had the patients see the doctor. But I think it's really interesting. And, if we continue to grow our practice, I think we'll have to maybe consider having our technicians be more involved and having visits without seeing the doctor. But for now, they all the patients see me, and the technicians work directly with me.
And Jackson, what about for you and your scheduling?
I think for the most part, we do a combination of everything. So with the students and technicians, they'll be working on patients, and that'll be the patients that I see that day. And then, as I alluded a little bit earlier, I think the NCLE staff who are much more well-trained and they have a lot more knowledge as far as contact lens fitting themselves. We do have them operate on their own schedule, but we're certainly just literally right next door. And oftentimes, if it's just a routine check, they may just say, hey, everything's going well, especially for the Ortho-K checks where, frankly, I may not technically really want to see them more than once or twice a year. But for the purposes of monitoring axial length, I may want to see them a little bit more closely as far as follow-up schedule. So there's just many ways to approach it, and we tried all the different methods throughout. And so I think this works for us, and it continues to work really well.
Christie, I understand you had your own schedule,
It
and
wasn't my own schedule.
You had people that were nearby in case you needed a check-in for any reason.
Yeah. So like, if there was any type of anything like with the cornea, or even lids and lashes that were outside of what I consider normal, just running to the doctor and saying, hey, I've got some infiltrates here. Do you want to come take a look? We worked pretty closely together. So especially for like grade 2+ or higher GPC, things like that. We kind of already knew like what they wanted to do. So the patient was usually pretty well educated before the doctor came in to take a peek, and we'd already kind of prepped them if I knew the doctor wanted to do like either a preventative antibiotic or some sort of steroid or something. So we worked really closely together and just kind of understood, there's a lot of trust involved. So just understanding like the limits of your role and what you can and can't do, and getting somebody else involved when it's over your head. So stay in your lane.
It's always nice to have somebody in the trenches with you when you're in over your head.
Yeah, no, there's typically like at least two ODs that are on at any time. So whenever necessary, we'd just grab somebody and pull them into the room.
So I'm going to switch gears now and talk about marketing your specialty vision practice. I think a lot of people want to know how to engage other practitioners, patients, everything. How do you get these patients that have these specialty contact lens needs into your office, into your chair? So Kate, how do you get the word out about your offerings and your skill set?
Sure. For me, it was really important to make personal connections with other doctors in our area, both ODs and MDs. I found that really useful. So we had some other smaller private practices in our local area who didn't want to fit specialty lenses, didn't want to do orthokeratology. So we would make connections and make it known that we would gladly help their patients, and keeping the line of communication open. So if they're kind enough to make a referral to you, keeping them updated on the patient's status, sending records, which is really easy with EHR now. So making that connection was really important. And then with MDs in the area, I've also found that that's really useful. They have typically a high volume of patients that they see. And the MDs in our area really, they want to know who fits specialty contact lenses, because it's not something they personally want to do. So whenever they would find out that that's what I did, they would get really excited. So there was a couple of days I would go maybe shadow an MD. In Ohio, we can even get CE credit for that. And then having that connection with that MD in your area, and maybe having spent a couple hours in their clinic, I think built a little bit of trust. And I've seen a lot of referrals from doing that.
It's really cool that you can shadow them and get CE for that. That's impressive. Did you ever have any pushback from any of them regarding orthokeratology?
Yeah, I mean, I think that can be a tougher conversation. They're admittedly more interested in the scleral lenses, but those are also a lot of the referrals that I was getting, because the cornea docs, they want to send their keratoconus patients and things like that to you. Admittedly, it's just been tougher to get those relationships with some of the pediatric ophthalmologists in the area. So I'll be honest, we have a lot more work left to do on that. So if any of their panelists have good tips on that, I'd actually love to hear that.
Jackson, I'm going to throw this to you then. How did you get the word out about your offerings and your skill set?
Yeah, this question comes up a lot, and I think it ultimately comes down to doing a combination of both in-house and sort of outside networking. Internally, if you already have a strong primary care patient base, then I think it's really important to have the mindset of every single patient that walks into your door and in your chair, think, is there any opportunity for me to educate on specialty contact lens offering, right? So myopes, they're everywhere. And just because they're past age 20 doesn't mean that you can't offer a specialty contact lens like Ortho-K, right? We have adults who are doing monovision Ortho-K, and they're amazing. They're sometimes titrating their own wear time so they can have different levels of ads for their, multifocality of their monovision, right? We also practice obviously in the heart of Silicon Valley. And so, if we think of how scary it is to have an engineer patient, 99% of our patients are engineers, so they always want the sharpest possible vision. So I sort of made a little name for myself as being the translating multifocal GP doctor, because they all wanted the crispest, sharpest vision, and not a lot of nearby doctors wanted to deal with that. And frankly, it wasn't particularly difficult once you got the hang of it. And that's where having really strong consultation team helped, and then just being sort of fake confident that, hey, I can do this. And eventually you'll be real confident that you can do this once you get enough experience. So I think that's the internal building. Certainly when I was a little younger and a little bit stronger, I would go out with the feet on the ground. We would visit offices. We would go to pediatricians' offices, dental offices, you name it, dermatologist office, if we were trying to grow dry eye, which would help the specialty contact lens practice, right, for potentially scleral lenses. So there's just a lot of effort involved. It doesn't come naturally. And so, well, maybe for some people it can, but for most people, it probably still takes a lot of true sort of grit and grind as far as just marketing all your services. And don't be afraid to tell people what you can do. Some people are a little bit more hesitant, especially early on, if you're not too confident, but that's where, fit all your staff members in the office. And then you can tell your patients that, hey, I'm very experienced. I fit, 10 people, and like, oh, wow, this is amazing. So ultimately you have a lot of people that you can use as resources within your own office to help market. And then those staff members will be the advocates for you once they realize, oh, wow, I'm doing Ortho-K. You should consider this for yourself or your child, for multiple reasons, not just vision, but obviously for myopia management and slowing eye growth. Those are the other reasons, but there's a lot of things that you can do from a marketing perspective.
Presume, Kate, that you're getting a lot of your Ortho-K referrals the same way that Jackson's saying, with the families and internal patient relationships and things like that. Any other strategies that we didn't touch on, or anything else you want to add about that?
Yeah, we're fortunate enough. One of our offices is a pediatric and vision therapy office. So I see a ton of referrals internally. So if you don't have a pediatric office or a pediatric doctor in your own practice, go visit those practices. They're seeing all of those patients, all of those young myopes, and a lot of the pediatric docs may or may not want to fit Ortho-K. They may not be comfortable with some contact lens stuff. So I would seek out those practices. That's a great referral source, if not internally, externally as well.
And we're lucky to have Christie Yee, who wears this hat of an implementation specialist with Euclid. So Christie, when you're doing your meetings with different providers and practitioners, do you touch on marketing with them? And if so, how do you talk about it?
Yeah, so that question comes up a lot. Actually, I think a lot of providers feel they need to be doing a lot of external marketing. So they have a lot of questions about, like, how do I utilize social media? And, in terms of like a budget, like, what should I be looking at? And so the first question that I usually ask them is, what is your internal capture rate? And they look at me like I just spoke a different language, because they're not tracking that. And so I think it's really important, before you try to spend any sort of like financial investment in a third-party company to try to market your business, you probably want to make certain that you're being highly effective with the patients that are already in your office. And so one of the things I recommend is, for the next couple of months, let's just track how many myopia management conversations you're having and how many of those you're actually converting. Because let's say you're seeing, having like 6 conversations a month, and each one of your myopia management patients is worth like $2,000. If you're only capturing 50%, so 3 patients a month, you're leaving 3 on the table. At the end of the year, that is $72,000 that you're leaving behind. So my challenge then would be, like, how can you, with your approach and, through practice management, how can we improve your capture rate so that way you're capturing more of the business that's already in your practice effectively? Once you hit about 75%, then let's start looking about kind of reaching out and trying to bring more patients in. The one exception I will say is that I do recommend, kind of to what Dr. McClure and Dr. Lau have already suggested, is really getting those local pediatric providers involved. And so one of the ways that I've done this, because I did try to reach out to a couple of our pediatric providers, and they're just as busy as you are. So trying to get some one-on-one FaceTime with them can really be a challenge. And so one of the things that I was doing that I found success with was sending managed care letters to all of my myopia management patients. And so I was just sending like hey, this is Johnny. Johnny has been enrolled in a myopia management program. these are my expectations. We're going to follow up, and I'm just going to send you regular updates to all of their pediatric providers. And then I just put in a brochure about myopia management because they probably never heard about it, along with my business card. And so this is a really non-aggressive nudge to really introduce the concepts of myopia management to these pediatric providers, because all of these providers are doing well child visits where they're actually doing like some sort of like visual acuity or Snellen chart. Our pediatric provider actually has like an app on their phone that does auto refraction. So these doctors oftentimes know when the kids are myopic before they ever even leave the office. And so we were actually able to pick up a few like local pediatric providers, just insta referral right to our practice. And so that was like a direct stream of age appropriate myopic children right into the practice. So it cost me like literally nothing to do that. I used letters that I'd already, basically I just had to add like the child's information in there. It took me like literally 2 seconds to print an envelope. So a really good time investment on my part, but that was pretty much the extent of our networking efforts, just really making certain that, we're being highly effective in our own, I guess, fishing in our own pond. Was like one of the best strategies. It was shocking when we actually started looking at it, how much opportunity there really was. When we did the math, it was hundreds of thousands of dollars, not 72. It's a lot. There's a lot of potential there that you probably don't realize.
We had a question, is it possible to get template letters?
Yeah, if you reach out to me, I do have a sample informed, or let me try that again. I do have a sample of a managed care letter that I could send you.
At the end of the presentation, we actually have a QR code so you can schedule directly with Christie and her implementation meeting. So yeah, excellent question.
Yeah.
Are any of you using social media to get the word out about your practice? Or I can throw it to Kate.
So not as much. We just now have someone in our team that is doing more with social media. I have found if we spend more efforts, I think as Christie sort of mentioned, with the patients we have in our practice, that's been really beneficial. I would say for every Ortho-K lens and child that I fit, I probably get another 2 to 3 in return. You fit one kid, and then this girl, she plays gymnastics, or she does gymnastics. Suddenly, I have 2 of her other teammates in my chair, the next week. And then finding those communities where you'll fit one of the children, and then before you know it, you'll see several more. So we've really invested the time in making sure in our office, as Christie mentioned, we're capturing those patients and those fits, and then that will bring you more in return. So probably should use more social media, but hopefully we'll get there.
Yeah, I would echo the sentiment. The other group are the water polo people, water polo kids. They're always struggling with using their contact lenses under the water. And that's where we have so many water polo patients that just love Ortho-K, and then they're sending all their teammates over to get fit. So it's just there's just a lot of opportunity out there.
This question is directed to Christie. What is your definition of managed care when you were referring to that?
Yeah, so I kind of structured my letter off of like a glaucoma managed care letter. So something that you would send to like a primary care provider in regards to like their overall health update, or even like a diabetic managed care letter. It's just updating their primary care as to where they're at and how they're doing, and kind of what you see as far as the treatment plan going forward. So just kind of keeping all of their healthcare providers on the same page.
We also had somebody mention that baseball kids too are a great resource.
I actually had a synchronized swimming team. I didn't know that was a thing here, but we had one.
Yeah, all the sports teams, you name it, like swimming, baseball, football.
It's great. The next topic is presenting fees to parents and patients. Does that get in the way of establishing care? So, Kate, how are Ortho-K and Scleral lens fees discussed in your practice?
It depends somewhat on the patient in the chair and how they got there. So if it's a new referral or a new patient, a lot of times I need to see the patient first to determine what's appropriate. Are they a good candidate for a scleral lens, or do they need more of a GP? If it's Ortho-K, are they within the Ortho-K parameters? Do they have a healthy cornea? So new patients, I really like to see them first. And a lot of times, since I'm in the room, I'll start to have that conversation. I do have a great technician that if I need to go maybe, sneak out and see another patient, she can start that conversation for me. It's a little easier if they're an established patient to our practice because I already have all that data. So I know coming in, okay, yep, this is a myopia management patient. They're a great candidate for Ortho-K. Looks like that's what they're excited about. So my technician will go in, she'll maybe capture some data, some pre-testing, and then she'll begin that conversation, which is really nice. And to train that technician, she heard me have that conversation quite a bit. So in the beginning, I was having the conversation with the parents and patients, and then eventually she felt comfortable after hearing me have it a few times. So it is helpful to have a staff member that can do that, that can free up some of your time. But certainly, I think there's multiple ways to do it. And I'd be interested to hear how some of the other panelists handle it as well.
Watson, you want to take that?
Yeah. So I probably had many different styles in the different practices that I've worked at. The one that I currently work at, and the one that resonated most with us was following sort of like the similar to the surgeon's model or the medical model. So what that meant was, I could just be free to talk about purely the treatment and recommendation for the treatment. And I'll try to give the patients a range in fees. That way they're not completely blown away when they actually hear about it. But similar to a surgeon, I don't think they're usually talking too much of the fees directly. I'll send them over to our myopia counselor or our, whether it's the contact lens counselor who's going to talk specifically about fees, just like a surgical coordinator would. And that's where they'll give the more specific details. I think that's sort of helped me emotionally, just so that I don't have to think about it so much in terms of, either prejudging the patient as far as what they could pay or what they're willing to pay. I think the approach is more, this is what I recommend for you. My staff are going to talk to you. And certainly if there are difficulties, I will be brought back into the conversation, but it's more, this is the recommendation and someone else is going to have that conversation. But I've done it the other way before where I've also given the fees. It just was a lengthier consultation and I sort of like this method better for me. But I certainly see that there's value in all the different methods.
Christie, I think you were one of the members that had to deal with all of this as well. So
yes,
is there anything you want to add?
So I think psychology-wise, the way Dr. Lau is approaching things now is actually a really great way to do it. Obviously, I didn't have a staff. I was like the fitter and staff, and I wore all the hats. So I had to have those conversations. And so my approach is probably a little bit different than what most optometry offices have. But for Dr. Lau, the way he's separating it, he's at that time keeping the focus specifically on the eye care, on the eye problem. And I think one of the pitfalls, especially with myopia management, is when a doctor introduces the concepts of myopia management and then they roll right into the fees, it comes across as like a really expensive upsell, almost like, would you like the blue light filter on your glasses? Only this filter costs $2,000. So it comes across as really expensive eyewear versus, like this is really serious eye care. And so by keeping that conversation on the eye care and keeping that really well focused and defined, I think it allows the parents to separate the two a little bit. So I think that approach is probably one of the more effective ones. How I was doing it in my practice, because I needed some separation, is at the end of the exam, the conversation for us, we would introduce the concepts of myopia management and suggest that they come back for a routine or for the comprehensive myopia management evaluation. And that's where we're going to do a lot of the scans and really determine what that best modality is. And so that conversation, kind of sort of went something to the effect of, the good news is we've completed your son's routine eye exam. Everything in the back of his retina looks great. Unfortunately, we're really concerned about the rate of the progression of his myopia. And, long-term, if we let this go unchecked, he could have lifelong vision complications, including permanent vision loss. So what we'd like to do is set up a consultation for you and your family to come in. There's some special testing we'd like to do. And then together, once we have those results, we can really discuss what those next steps are. And then basically, I had a brochure that I would give the parents kind of at the end. Again, I'm keeping this conversation mostly focused on the eye issue. And so basically, I hand them this brochure, and the conversation around it was like, here's the 3 most common modalities we use to address progressive myopia. And then this unfortunately probably isn't covered by your insurance. We can discuss the fees once we have some more data after the special testing. But don't worry, we take the FSAs and the HSAs, and there's payment plans available. So kind of introduce the concepts that there's probably going to be fees that they're going to have to pay out of pocket. And again, if they kind of ask about it, I'm like, you know what, that's a really great question. I don't have the answers to that right now. As soon as we do that scan and we have a little more information, I'll know what your child is a candidate for, and we can just kind of go from there. Because again, I want them to keep the focus on the health aspects of it as well. So they're aware that there's going to be fees. They're prepared to hear that coming into the follow-up appointment. But I'm keeping them focused on the actual eye health condition first. So that's kind of how I approach it. And then we typically work on a global fee, so it really doesn't matter what modality. But again, I'm just trying to funnel all of that, the focus into protecting their child's vision first and foremost, and then we'll deal with the payments and stuff at that follow-up visit.
I would just want to quickly add, I think we hear so many consultants always say, oh, you have to raise your fees. But I think one of the nuances of that, in my opinion, is that, especially if you work in a saturated area, you have to have justification for those fees. And if you're not providing the value to the patient or the parent, then it doesn't matter, what your fees are. They're not going to be interested, whether you're high or low. And I think the justification in that value, I think, comes from a couple things. One is being able to provide pure expertise, like you actually learning about the craft and really spending hours to understand everything really, really well. So having that expertise, almost all the doctors in our office are either residency or fellowship, have something to their names. And so in a very competitive area, we have patients that actually look for that, because every person claims that they're a specialist, right? So ultimately, we do have the backings and education to support that. Number 2, I think we provide really beautiful experience for the patient and doctor. We have the technology. So, fortunately, we do have like axiobiometers so that we can actually like say, hey, we're tracking this carefully every couple months. And this way the parents see the value in why we're, why come to us for myopia management? Why not just go to the doctor down the street? So if they don't understand that value or really believe in that value, then it doesn't matter what you charge. They're going to go to somewhere else. So I think that's super important.
Yeah, I think you nailed that right on the head. The value truly is in the therapy that you're providing and not the modality that you're using to address the progressive myopia. I don't care if the contact lenses are gold plated. $2,000 is not like, there's no contact lens that you're going to find that's got a value of $2,000. Well, maybe the Mojo lenses if they can ever get that figured out. But like just in general, it really truly is in the therapy and the service that you're providing. And so keeping the focus on that versus the modality that you're using, I think is really important.
This question came in, and it's how do you tackle the question for atropine comparing to Ortho-K in terms of safety and affordability, since patients prefer eye drops over contact lenses for younger kids? Does anyone want to volunteer for that question?
So, for me, it's really about getting to know the parents and the patients. And actually, this is sort of the same mentality I have whether we're fitting Ortho-K or I'm fitting diseased cornea. It's all about chatting with the patient, finding out their needs, their concerns, what their day-to-day looks like, and finding a modality that best fits their lifestyle. Because it doesn't matter if it's drops, if it's contact lens, if it's a scleral lens, if it's gas perm lens. If it's something the patient's not willing to do or it doesn't fit their lifestyle, then your treatment's not going to work. So you really have to take the time to get to know the patients, the parents, and what their expectations are as well. So just having that conversation, I think, is really important. And as Christy mentioned, we also do a consultation appointment, whether it is for a scleral lens, specialty lens, or it's for Ortho-K or myopia management. We're having that consultation appointment to really, as it's been explained, explain the different treatments and talk about the importance and that value, but also getting to know them and what their concerns may be or what their needs are. So that's, I think, really useful. And motivation. You'd be surprised how many young kids are motivated to wear contacts. With the competitive sports that start at a young age, I find that sometimes those kids are more motivated for contacts than they are drops, because there's for a young kid, there might not be any perceived value of the drops, but for contact lenses, the perceived value for the kids is, wow, I don't have to wear my glasses during the day. And that's really exciting for me. I don't have to wear my glasses, when I play baseball. So taking that time, I think, to understand their needs and their concerns will really pay off. So hopefully that answers the question.
Yeah, if I could add, I would just say, I just had this week at a patient and parent that said, I prefer atropine, and we weren't fighting it, that's what they preferred. And it was just, here are the 3 options that are approved in the US. They're all pretty good in terms of efficacy. We recommend based on lifestyle, based on maturity. And if that's what your child needs, that's what he needs. And we didn't fight that, we prescribed atropine and they were fine. Certainly if it's a question of, okay, we really want to build the Ortho-K part of the practice and deter them away from atropine, I think that's a different sort of question. But I don't think, as Kate was alluding to, it's what does the patient actually need, right? If they're not ready for contact lenses, then there's no need to try to force them to it. But if they are ready, you can tell them the pros and cons, and then certainly have that open dialogue. You can nudge the parents one way or another if they really are, not sure what to do, but ultimately you got to do what's right for the patient.
We're going to switch gears to lab partnerships. So, Kate, what are your criteria for partnering with a lab?
For me, it was really important, especially early when we were getting our myopia management clinic up and going and specialty lens clinic, having labs where I had that personal connection with the fitting consultants. The fitting consultants were easy to contact, were available and helpful. And that's been really nice. And for me, getting to understand the designs better. And I also appreciate a quick turnaround in manufacturing. That's nice for me and for my patients. So, I think there's lots of different angles to look at lab partnerships, but for me, it's really those personal connections and having the consultation department that I really trust and that I find really helpful.
And Jackson, what about you when you were determining your lab partnerships?
Yeah, I was very into strong consultation. I always felt like they knew so much more than I could ever learn, given that they're seeing, they're discussing these kind of cases 10 times over versus the one case you might see a week. So I really wanted to make sure that I had a strong consultation team that I trusted, that I could work with the people that I wanted and not feel like I'm just getting pawned off to the next person. And so that was really important as far as having that relationship. And then I was really into features. I like that lenses have all the features available that I can fit my most simple patient to the most complex patient. Not that I stuck with one brand. We have a whole drawer, full wall full of fitting sets, but ultimately what would make me lean towards a partnership with a certain brand is if I felt like they had all the features I needed, where I could just, use it for the majority of cases. They had a strong consultation team. And then ultimately customer service. Like, we've been really put off when customer service was not satisfactory. In any kind of relationship, you're always going to have issues, but if they're not willing to work with you and you believe you're a reasonable person, then maybe that's not the right partnership for you, right? So I think make sure that you have all those major important points. For the most part, many manufacturers are now all pretty great, right? Like, it's not like there's only one or two that can do the job. So it's all these little fine details that make the better company stand out.
So with that, I'm gonna switch your hat from practitioner to Euclid manager of professional affairs, senior manager of professional affairs. I'm gonna have you just give a brief overview about Euclid Vision Corporation.
Yeah, sure. I didn't realize the hour went by so quickly, so we're already towards the end. So just as the last outro for who we are at Euclid, turning on my corporate hat. So Euclid's been in business for over 25 years, focused just on myopia management. The strength has always been what I alluded to earlier, was just having strong consultation, strong customer service. Whether you're a beginning fitter, the simple fitting process yields a first fit success of 87%. I think that's amazing. But as you become more proficient, more advanced, if you want to do more modifications and parameter changes, you have that flexibility to make all those parameter changes with a lot of precision. And by using either our online platform, My Euclid, you can do all those changes live. You can make those adjustments and see those changes in real time. Or we have a lot of longtime patients that just love getting on the phone, calling their favorite consultant. That also works. Every single order will be reviewed by our highly expert consultation team. So, and then lastly, why I believe Euclid is just an amazing company to work with. We're strong. We're very, very strong in our innovation. We're constantly sort of looking at new ways to design and innovate with materials. So our latest offering, Euclid Max, offers everything you would want in a overnight Ortho-K design. That same 87% first fit success, amazing wettability without the need for any kind of plasma or surface coating, 180 DK hyper DK material, and ultimately very durable, can resist things like chips, scratches, breakages. So we're finding really good success rates with Euclid Max. So that's our little plug on the Euclid side.
Okay, so I'm going to put my hat on for Visionary Optics. I am the Director of Clinical and Scientific Affairs. And if you're not familiar with Visionary Optics, so I'm going to just put on the scleral hat right now. There's been over 20 years of scleral lens experience with Visionary Optics. They really strongly believe in innovation and research. The scleral lens shape studies the scleral shape studies have come out of the work from Visionary Optics and Dr. Greg Denier. As far as customization, there's so many ways that you can customize the scleral lenses that are from Visionary Optics. It originally started as the Jupiter lens, and it graduated to the Europa lens. And Europa has a new version called the Europa Tangent lens. And so everything's evolving. And I believe, Kate, you use both Euclid and Visionary Optics products. And the turnaround time for Visionary Optics is that the lenses leave the lab within 2 days. So I'm hoping that you're actually benefiting from the speedy turnaround time.
It's really impressive, actually. Yeah. Mm-hmm.
So lastly, the next steps, I'm going to have you cover this for Euclid side, Jackson.
Yeah, sure. So if you're new to Euclid, if you get certified within a month by July 28th, you'll get your first pair of warranted lenses free. You'll also get to talk with our amazing implementation and practice management specialist, Christie. There's her QR code. She can talk a little bit more about that herself. But we found that, speaking very honestly, doctors at every level of their myopia journey, they rave about their time with Christie and how they're helping them grow their myopia practice. And so I'm assuming everyone on this call, you should be signing up with her right away because she gets pretty busy. So take it away, Christie.
Yeah. I'm looking forward to helping you all with any of your needs in the practice. The hour is yours, so there's really no set like slide deck or anything like that we use. So I have practices that are just getting started with myopia management that really need a lot of guidance with everything from like informed consent and wearing contracts to even just discussing like the pros and cons of various pricing strategies. I've got you. I've talked to well-established practices that are just looking at how do I implement more staff engagement and getting staff involved so I can optimize my efficiency. So whatever roadblocks or hurdles that you're encountering, or just ways to maybe improve your practice, feel free to reach out. I'm happy to help. The only thing is that you do have to be an active Euclid account holder. So if you haven't, make certain you use the QR code to get certified.
And then as far as Visionary Optics, there's a webinar discount tonight. You'll receive 50% off a Europa Tangent fitting set. So the fitting set's normally priced at $350, so you get 50% off of that with the code WCW23. If you use that QR code, that'll send you to our welcome page where you can set up an account with our lab, and basically you can determine where your fitting set's going to be sent to and all of those details. Lastly, I offer one-on-one peer times, peer-to-peer sessions. And so basically, if you're having problems troubleshooting a lens or a challenging patient, I'm there for you. If you're very new to scleral lenses, we take the time to walk through how to assess fits, how to evaluate fits, how to schedule your time, what to look for as far as complications are concerned. And if you're an experienced fitter and you're just looking for a new fitting set, I can do a really quick 10-minute crash course on the Tangent to get you up and running without having to look at a fitting guide. So that's what we offer. And I have some questions coming in, and we want to thank everybody for their time today. We're going to stay on and answer some of these questions that are coming in. And if you log off now, just again, thank you so much on behalf of Euclid and Visionary Optics for your time this evening. So one of the questions is, do any of the speakers have any promotional brochures that they can share with regard to sports or swimming clubs, or anything that you have that you leave off or drop off with people? Or
we had one that we were using for a while that was from Euclid. So it was great.
Great.
It was a long time ago, but I'm sure they've got new and updated brochures too.
We do have plenty of brochures. Feel free to reach out to me. You can use my email for that, and I'll get you in touch with the sales rep in your area who can send you a bunch of promotional material. We have posters too.
Oh, great.
Yeah. I found that it's really helpful to partner with your lab for those products, and that way you don't have to create them, and they're usually really nice.
Hey, what supplies do you need to set up your specialty lens clinic?
So it's really important to have all the tools that your patient will need to take home that day. So insertion and removal devices, the plungers, and I like to provide a sample of solution. So either Boston Sunplus or Unique pH, we always have starter kits of those in my office. We also used to have hydrogen peroxide sample solutions. Those are hard to come by these days, but we'll provide material to the patients where for where they can obtain those starter kit or the solutions. And then making sure you have the appropriate filling solution for scleral lenses. We sell that in our office, not to make money, but I want to make sure that my patient has what they need to fill their lenses. Otherwise, they'll get creative at home, which is never a good situation. So you really need to have a kit for your patients. We have a large bag that we fill that will have all the tools. It'll have a box of Lacropure. And then we'll also provide some educational materials, insertion and removal tips and tricks, which I find helpful to have to give that all-in-one set, all-in-one set to your patients before they leave.
Before I forget, Visionary Optics also has their own scleral lens filling solution that you can sell directly to your patients too. If you're interested, it's called Vibrant View. So you can reach out to your sales representatives if you're interested in learning more about that. This is going to, we're not going to discuss fees exactly, but in general, the global fee, they were saying, what does the global fee include for all three modalities, atropine, Ortho-K, and soft multifocals? Do you have a global fee that includes, is it separate for each modality, or do you have a global fee that encompasses these three categories? Kate, I'll just throw it your way.
We have a global fee for myopia management contact lenses, which has been really useful because it takes some of that anxiety, I think, for parents having to decide, well, which one, this one's cheaper. It's like, nope, it's the same cost. It's a global fee, no matter what type of contact lenses we choose to do for myopia management. Atropine's a little different in our office, but that's just the way we've done it.
And I guess we can't talk about the fee directly for scleral lenses, but speaking of scleral lenses, when it comes to pre-authorization, how are you handling pre-authorizations for scleral lenses? Jackson, I'm going to throw that one to you.
I think that's one of the more difficult ones these days, especially with pretty difficult processes and reimbursements for medical-based reimbursements for scleral lenses. Ultimately, you have to fill out the letters. You have to find, make sure that you're following the rules of the specific carrier that you're working with. But a lot of times, if you are going down that path, to actually get compensated for the level of work that you do, I've seen a lot of doctors, probably bill for photos, things like pachymetry, things like anterior segment imaging, OCTs. I've seen that route as far as for billing for scleral lenses. But maybe fortunately, maybe unfortunately in California, we're very VSP heavy. So that just takes a lot of the headache a little bit away because a lot of our, again, in the Silicon Valley, they do have good employer medical necessity based plans. So we get fairly reimbursed for those services. So we're not nearly doing as much of the medical billing for scleral lenses.
Kate, what about you?
Yep, we definitely employ staff members that can help with that because I barely have time, to see the patients that we've got. So that's something you absolutely have to have staff assistance with, is doing any pre-authorizations. Similar to Jackson, we have a lot of patients that are on vision care plans. So making sure that you have those plans pulled before the patient arrives is really important. So when the patient comes in for a fitting, I know what benefits they have, what they're available for, what we may need to bill to their vision care plan, or do we have things we need to build in medical. So it's really important that you're organized and have that information before the patient's even in your chair.
Well, if there's other questions that we unfortunately didn't get to tonight, we will have the transcript so we can reach out to you and answer your questions separately. Again, thank you so much for your time this evening, and we really appreciate you spending your evening with us.
Lynette, if I could just say one last thing, there was a mention that ABB is officially now a licensed manufacturer for both Euclid and Visionary Optics products. So just wanted to make sure everyone in the audience knew that before we signed off.
Thank you, everybody.
Thank you. Have a good night.
Great.
Thanks.